Welcome to our video about the causes of bad breath. There are several causes of bad breath. These include dietary habits, certain medications, periodontal disease, and dentures. To learn more about these conditions, read the following articles. You'll be surprised by how many of these causes are completely preventable. You might even be surprised to discover that smoking is one of the most common causes of bad breath. Thankfully, quitting cigarettes is easy and can improve your breath while improving your overall health. Medications. Many different medications cause bad breath, including antibiotics, antihistamines, sedatives, decongestants, and anticholinergics. Vitamin supplements can cause odor as well. Some can cause a fruity smell when taken in high doses. However, it is important to note that some of these medications can also cause severe side effects, including the risk of developing ketoacidosis. This condition is potentially life-threatening and should be treated with caution. If the smell comes from your mouth, you may have a medical condition. For example, diabetes or gum disease can cause bad breath. Poorly controlled diabetes may cause the breath to smell like nail polish, fruit, or nail polish. If this is the case, it's important to visit a dentist or internist. Both can help you find a treatment plan for your specific needs. Some medicines are prescribed for temporary relief. In order to determine whether a specific medicine is causing the smell, you should get a medical history from your dentist. The doctor will ask about your dietary habits, tobacco use, and any other medical conditions you have. The dentist may recommend a specific antibacterial mouthwash or a specific treatment for your bad breath. The best treatment is to follow good oral hygiene habits and use mouthwash containing cetylpyridinium chloride. Periodontal disease. Periodontal disease, also known as periodontitis, is one of the leading causes of bad breath. This condition develops over time as a result of improper oral hygiene. As a result, plaque and calculus begin to build up underneath the gum line, creating an ideal environment for pathogenic bacteria to thrive. Left untreated, periodontal disease can destroy the bone that surrounds teeth and the jawbone. The best way to prevent gum disease is to have regular dental cleanings. While brushing your teeth and gums daily is important, it is essential to brush the tongue as well. Bacteria often linger on the tongue, causing a bad odor. You should also floss every tooth daily, as toothbrush bristles cannot reach these areas. Flossing will help remove any leftover bacteria and plaque. In addition, you should visit a dentist for routine cleanings at least every 3 months. When your gums are unhealthy, the bacteria that cause bad breath can breed on the tongue. If your tongue is causing your bad breath, you may have periodontitis. Your periodontist will be able to diagnose periodontal disease. Treatment may involve deep cleaning to remove bacteria that have built up above and below the gum line. Antimicrobial medications may be prescribed by your periodontist, depending on the severity of the disease. Dentures? Keeping your dentures clean is important. Brush them once or twice a day with a soft bristle toothbrush and rinse them well under running water. Rinsing your dentures before bedtime is especially important as this will keep bacteria and other odor-causing particles from growing on them. Denture cleaning can improve your overall confidence. Consult your dentist for further advice on proper denture care. It is also important to rinse your dentures every day before you go to bed to avoid bad breath. There are a number of causes of denture breath. Whether you have an ill-fitting denture or are simply allergic to certain materials used to make dentures, these reasons can lead to an unpleasant odor from mouth when wearing dentures. The most common cause of denture breath is not cleaning your dentures well enough. A good solution for this problem is soaking your dentures overnight in a solution that kills 99.9% of bacteria that cause odor. Another cause of denture breath is dry mouth. Saliva helps keep bacteria away from mouth tissues and is produced in sufficient amounts by mouths during the day. If you are experiencing bad breath while wearing dentures, talk to your dentist about a dry mouth treatment. A few simple steps can help you avoid bad breath when wearing dentures. First, you should take the dentures out of your mouth before wearing them. Next, you should place them in a plastic bag and sniff them. The bacteria that cause breath odor can live in the nooks and crannies of your dentures, and if you don't brush your dentures regularly, they may be harboring a number of harmful bacteria. Dry mouth. Dry mouth is a common cause of bad breath. About 1 out of 4 adults suffer from some form of dry mouth. They may try to avoid it by drinking more water or chewing gum, but this usually only worsens the problem. In addition, dry mouth can also affect one's sense of taste. In such a case, the only real solution is to find a treatment. This article will outline some methods for treating dry mouth. One of the easiest ways to treat dry mouth is to drink more water. Water keeps our mouths moist, and helps to rinse away food particles that cause a bad smell. It is also important to brush the tongue to remove any food particles that have stuck to it. While brushing your teeth is the best way to eliminate the smell, it is equally important to avoid dry mouth and to use a water-based mouthwash. This will not only freshen your breath, but will also help prevent the odor. Another simple way to stop halitosis is by using a mouthwash to remove food particles and bacteria. However, these products can't address the root cause of bad breath. For more information, consult a doctor or dentist. Some medicines may be effective in treating dry mouth, including a mouthwash. A visit to the dentist is also necessary for children with persistent bad breath. The problem could be a cavity or gingivitis, so it is important to seek treatment early. Moreover, bad breath that is accompanied by fever may be a sign of a more serious infection. A strep throat, for example, requires an antibiotic. Acid reflux. Many people suffer from a bad smell from mouth because of acid reflux, also known as gastroesophageal reflux disease, GERD. These burps can be minor nuisances or uncomfortable, and can even cause a bad smell from the mouth. Acid in the stomach can be highly caustic, causing excessive wear on the teeth. It also damages the enamel and causes tooth decay. Long-term exposure to acidic foods can also lead to a more sensitive mouth. If you have bad breath because of acid reflux, it may be the source of your problem. The stomach acid is backflowed up into the mouth, and can cause gas particles to attach to the tongue, intensifying the bad smell. Sometimes, the smell is accompanied by burping, which further exacerbates the problem. If you have persistent bad breath due to GERD, you should visit a dentist. Treatment for acid reflux varies, depending on the severity of your symptoms. In most cases, bad breath will go away on its own within a week or two, but for chronic GERD, medications may be necessary. Keeping hydrated is an important part of the cure for bad breath. You should also avoid eating spicy or acidic foods. You may also want to consider using mouthwash and breath mints to help fight bad breath. We are so grateful that you stayed to the end.